Good morning, everyone, and welcome to Medicare Monday with Indiana SHIP. My name is Shawn Swindell, and I'm with my peer Megan Rogers. And today we're going to be talking to you about how to enroll in Medicare. But before we get started, I want to take a moment to wish my grandson a happy 6th birthday. Happy birthday, Jackson. Mama and Papa love you, and we'll see you this evening.
Happy birthday, Jackson. All right, thank you, Shawn. And sorry, everyone, for the delay. It's Monday, so we had some technical difficulties, but we got us up and running. So yes, like Shawn said, we are going to talk about how you enroll in Medicare. So before we talk about how you enroll, let's talk about when you're eligible for Medicare. So there are three main groups or three main situations that make someone eligible for Medicare. So the most common one is when you are 65 or older. And that's what I think a lot of people know of more commonly. You know, it's for seniors, for older individuals, but it's also almost any age group can be on Medicare. So if you're on Social Security disability income for at least 24 months, then on the 25th month of getting that disability check, you will also be eligible for Medicare, and that may be prior to the age 65. So we do have younger folks on Medicare, and then any age without any waiting period if you have end-stage renal disease or ALS. And when you become eligible for Medicare, you have 7 months generally to enroll. When it comes to turning 65, it's 3 months before your birth month, and then 3 months after. So Shawn, I have a true or false for you. You ready?
I'm ready.
All right. So when I'm eligible for Medicare, I call Medicare to get my Medicare A and B set up. True or false?
That would be false, Megan. So you don't call Medicare to enroll. You contact Social Security Administration to enroll in your Medicare Part A and or Part B.
Here's another true or false for you, Shawn. Are you always automatically enrolled?
No, not always. If you're drawing Social Security income, it is automatic that you will be enrolled when you become eligible. But if you're not taking any form of Social Security income, and when that time comes for you to be eligible to enroll, you will need to initiate that step of your enrollment into Medicare A and or B by contacting Social Security, and can do as early as 3 months before the effective date of your coverage.
And when you're automatically enrolled, when do you normally get that card, your Medicare card?
Typically about 3 months before your effective date.
So I think we're ready to talk about how you can contact Social Security. Is that right, Shawn?
Yes.
All right. So you want to tell us a little bit about how you can contact them?
Well, with Social Security, so you and Megan, at the end of the slides, I believe we have all the phone numbers for everyone to reach out, but you can contact them. You can contact your local office as well, schedule an appointment. You can apply online at Social Security, ssa.gov, I believe, to begin your process then. Did I miss one, Megan? Or did we cover it? We did online, scheduling appointment, going to the office, and making that phone call. So I think that's everything covered, right?
Yeah. I will add with the phone number This
Okay.
is our national phone number for Social Security. You are more than welcome to call that number, or if you want, you can Google the local number for your local office and call them directly as well.
Okay.
Here's another question for you, Sean. When I call Social Security, are they going to enroll me in my other pieces of Medicare?
No, and I typically get that a lot or hear that from Social Security administrators when people call to get their Medicare enrollment. Social Security folks are often asked to questions about what my options are, what Part D plans, how do I get an Advantage plan? And Social Security, is not able to help with that information, and they'll likely refer you on to a SHIP counselor. So they're just going to handle your enrollment, and then your options thereafter. SHIP can help you with, or you have other avenues to look into that as well.
Wonderful. So let's take a second to talk about what our other pieces of Medicare are. So first off, A is your hospital insurance, B is your medical. And as we talked about, and Sean walked you through the steps with Social Security, Social Security is only going to enroll you in your medical and your hospital insurance. And usually you are going to need more than just your A and or your B. So there's your Part D, that's your drug coverage. So just like it sounds, it's going to pay for your prescriptions or help cover your prescriptions. And then when it comes to your A and your B, there's a Medigap supplemental part of Medicare where it comes in as a secondary insurance, and it will fill in the gaps of what A and B don't cover as far as deductibles, co-pays, co-insurance, things like that. So you usually have an extra premium for that, but then you'll have little to no out-of-pocket costs with your Medicare once your supplemental covers your medical expenses. And then there's Advantage plans. And we see these commercials all the time on the TV every 5 minutes. And they are independent insurance companies that are contracted with Medicare to provide your A, your B, your drug coverage, and extra benefits like vision, dental, hearing, silver sneakers, transportation, things like that. It works differently than a supplement. It works a little bit differently than Medicare. They have to cover the same things that A and B covers, but your co-pays and deductibles and premiums are going to look differently. And these are all things that SHIP can sit down and talk to you about more in-depthly. But again, as Sean said, Social Security is not going to enroll you in these. They're not going to talk to you about the different options out there and what those options are. So how do you enroll into these other pieces? You are going to, you've got a few options. So you can go to Medicare.gov and you can put in your zip code and what kind of plans you're looking for, and you can put in your medicine and your pharmacies, and you can look for drug plans or Advantage plans. And they'll list all the plans for your zip code, and you can enroll in a plan directly from Medicare.gov as well. You can work with an insurance agent to help you pick plans. You can work directly with the insurance company of your choice. So if you already know that you want to go with insurance company A, you can contact them to enroll or find a plan that works for you where you live, or you can work with SHIP counselors. We have counselors all over the state. We can do in-person, virtual, like we're doing now, or over the phone, and we can help educate you on the different types of plans out there. What's the difference between an Advantage plan and a Medigap? What's going to work better for you? what are the pros and cons? What are the advantages? And we can help enroll you in advantage plans or drug plans. Did I miss anything, Sean?
I don't believe so, Megan. With that, I have clients that like to, they have all different options, as you mentioned, like SHIP counselors can sit down with them, have a scheduled meeting, go over their options, and just, remind everybody that, SHIP, we provide free impartial Medicare counseling. So we're not going to try to talk you in or out of anything. Sometimes it's best just to put the pencil to the paper and, and try to help people figure out what's best for them. I often get this as well, and I'm sure you do as well, where some people will make recommendations to their friends or their family member and say, oh, I have this plan and you should do this because it works great for me, so it should work great for you. But they don't necessarily know that Medicare is very individualized. So what works for you may not work for a spouse, or it may not work for your sister or your mechanic. So I try to let people know, like, hey, it's very individualized. It's not family coverage. So at the end of the day, it really is sitting with that person who's eligible or talking to them and giving them their options so that they can make the best informed decision. So I just wanted to add that piece in too. I know a lot of people like to make recommendations to their loved ones and friends and stuff. And sometimes what works best for that person certainly may not work for somebody else that they're making that recommendation for.
No, I love that, Sean. And that's a great addition. And I love how you commented on even the spouses may not have the same type of Medicare plans, especially with the drug coverage. I meet with lots of spouses. I don't know about you, but they assume they're both going on the same company.
Yes.
Because that's what they did with employer coverage.
Right.
And I'm like, no, it's based on your medicine. And most spouses are not on the same medicine.
Right.
So there's quite a few spouses that are actually confused that I'm suggesting two different plans. Well, why can't I go on the plan my spouse is going on?
Right.
Well, you can. That's an option, but you're going to pay more.
Right.
And this is the cheaper one. So no, I love that. And even, my husband and I have several years left for Medicare, but I know my preference is a Medigap, but I'm sure my husband's preference is going to be an Advantage plan. So
right. I know.
Mhm.
Yeah, that's why I wanted to bring that up, because I know, a lot of people, and especially when I meet with married couples as well, that is always a topic. Like, it's just, they believe it might be easier to be on the same plan. But I have seen firsthand a couple that were on the same plan, and it just wasn't working or covering things properly for one spouses. So I wanted to bring that up since we were on that topic a little bit.
No, I like that. That was great.
Okay.
So I am checking the chat box and it looks like Wendy is on. Good morning, Wendy.
Good morning, Wendy.
And I don't see any questions. Do you have any questions that came in on your end, Sean?
I do not. The ones that I already mentioned is typically what I normally get on average about. Sometimes people get concerned, when I refer them to Social Security to begin that enrollment, oftentimes they'll, if they're not ready to collect or draw their Social Security income benefits, then they question that. Like, I don't want to call Social Security because I'm not ready to, I don't want to file for my income yet. But they don't have to, unless they reach a certain age, and then they may be required to, of course. But when they're 65 and, they're eligible for Medicare, but they're not ready to draw their Social Security income yet, or retirement income, they don't have to. But when we mention that, initially they get a little concerned that they feel like they have to draw their income as well. And that's not the case when they're first turning 65.
That's another good point too. I get that quite a bit too, Sean, where
Okay.
they assume that the two are tied together, Medicare and their Social Security benefits. And it actually gets people in trouble because they don't get their Medicare when they should,
Right,
because they want to wait till full retirement age. And for some, it's 67 now.
right,
So that's a really good point, that just by enrolling in Medicare or calling Social Security doesn't mean you're enrolling into your benefits. They're separate.
right. They just have to begin the process with Social Security to begin their enrollment into Medicare.
Yep. Yep. Good point. All right. Well, let's talk about how people can get a hold of us. So if you have questions about your Medicare, anything that you heard today, you can contact us at 1-800-452-4800. You can visit us online. We're on social media like we are today. We Facebook, we Twitter, we YouTube, we LinkedIn, we're popular. As Susan says, she's ready to create a TikTok video. That should be fun. You can, if you have questions, you're watching this video later, we're not live anymore, you can chat in your questions. We do monitor the chat after the live. You can give us a call. You can chat us on Facebook. You know, we watch for those chats and we respond pretty quickly. If you have any questions or you want a one-on-one appointment with a SHIP counselor.
Great.
So we have some great topics coming up this month. This was the first Medicare Monday for May. Sean, can you believe we're in May already?
No, I cannot. It's flying by, isn't it?
I know. I'm like, it's gonna be Christmas before we know it.
I
It's
wasn't
crazy.
thinking that already.
Why? Well, it's just flying by. And we had snow in May. It snowed here last week.
Yes.
Yeah. Anyways, it's supposed to be warmer, so we'll see how that goes. But this Wednesday, Susan and Melanie will be back. They had other commitments today, so Sean was gracious enough to join me. And I will not be here Wednesday, but Susan and Melanie will. And they will have a special guest talking about the Indiana Medicaid unwinding. So what you need to know about how Medicaid is done with the public health emergency and redetermining individuals and their Medicaid status. So that will be a very important Facebook Live to join and watch. And then on the 22nd, we will be talking about mental health coverage under Medicare. So what services for your mental health you can get done that is just as important as your physical health. So some great topics coming up in May. So thank you again for joining us. Thank you, Sean, for being my co-hostess today.
Yes.
Let us know if you have any questions, and everyone have a great week.
Thank you, everybody. Have a great day.